Good morning, everybody, and welcome to the first Healthcare World Series event of 2024. My name is Steve Gardner. I am the Managing Director at Healthcare World, and welcome to a new year and a whole year of insightful and interesting sessions discussing the world of healthcare. We start 2024 as we start every year for the last 14 for me, in fact, with probably the biggest healthcare event in the world, Arab Health in Dubai, from the 29th of January to the 1st of February. And this year, Healthcare World is going to have an even bigger presence than ever before, running sessions on the Smart Hospital stage on Monday the 29th and having our own stage on Wednesday the 31st of January. We hope that many of you can join us in Dubai. And this morning's session is really about previewing that content and talking about some of the really exciting and interesting things that we've got going on at Arab Health this year. I'm going to be joined over the course of the next 90 minutes by some of the panelists and speakers that we're going to have with us in Dubai to talk about their sessions, what they're going to be talking about, and some of the insight that you can gain into global healthcare over the course of that week in Dubai. And where better to start than with the organisers, with the man who organises the whole thing all on his own.
Ross Williams. I wouldn't go that far.
Ross Williams, the event director of Arab Health for Informa. So I guess the first and most obvious question, Ross, is how's it going? How's it coming together for 24?
Well, if it helps, I had hair this time last year. You might remember.
I did.
No, it's been a good year. I think this time of year is always crazy, but it's always good fun. We're at those final stages now, bringing everything together, making sure that everyone's coming in and last few stands are sold and all of that kind of stuff. So it's a important time for us. It's a real crunch time now, making sure that everyone's ready to go.
So last year you had, remind us of how many visitors we had at Arab Health last year, because it was a record-breaking year, wasn't it?
Yeah, we had over 100,000 visits during the 4 days, and I think we had, sorry, I should have this really on the top of my head, something 60-odd thousand unique attendees over the 4 days, which was a record number for us. The good thing is our numbers this year are tracking really strong as well, and with the new paid entry to the show this year, which is a new thing for us, our pre-registration numbers are way above expectations, so that should mean we've got another good year on our hands.
So the motivation of not having to pay to get in obviously gets people moving a bit quicker, but it's not too late to get in, but you now have to pay a fee from this point. How much is that and how does that work?
Correct, yeah. So registration is still exactly the same. You go through the Arab Health website and register there. There's a 100 dirham fee. And when we go on site, it'll be a little bit higher. So obviously we're encouraging people who want to register to come to do it now, save some time on site and get your place confirmed.
Yeah, I mean, it's not a huge amount of money, but presumably you've just got to kind of keep some kind of capper and some kind of lid on the numbers after how many people overran the place last year?
Yeah, I think what it does, it gives us a good indicator of who's attending, so we can speak to our exhibitors, to our conference delegates, and tell them, this is what you can expect, and really start to drive our data, and we can market the show better going forwards and all that kind of stuff. So it's not just a cheap trick, it really does drive behaviour, and we want to keep on encouraging that as we go through.
So obviously the biggest development at Arab Health this year is the advent of the Healthcare World stage, but what else is new?
So this year we've taken on 3 additional halls. So we've added the Maktoum Hall, we've added the Plaza Hall outside the front of the venue near the Cafe Nero, and we've added Seville Hall 7, which is out by the new Seville Halls near the Novotel there. So that's really given us another 200 to 300 exhibitors on top of last year. And that's just showing the demand to keep coming to the Middle East, to have a presence here in particular. For us, it shows us that Dubai is the global hub for healthcare and for exhibitions and conferences. And, it keeps pushing that message of just how important Arab Health is. We know it's a well-attended show. We're not the biggest in regards to space necessarily, but I think when you look at it in regards to importance, and with the CME accredited conferences and the things like the smart hospital stuff that we do, it really just shows what an important show Arab Health is to the industry.
So what's the total? I mean, given you've got all that extra space and all of those extra stands, how many stands are there at Arab Health this year?
There's about 3,500 this year in total across the show. Yeah, so we've got everything from the small exhibitor pods on some of the country pavilions, all the way through to the Ministry of Health and those kind of guys that take hundreds, if not thousands, of square meters.
Have you thought about offering a little badge or something to anybody that can manage to visit them all over the course of the week?
They will get my respect. Manage to guarantee. And what more can they get? What more can they ask for? But yeah, I think that's some undertaking over 4 days, but you never know.
What can I say? I mean, I've been looking to try and get your respect for years. So get it just by running around a bunch of stages. We're going to move on to talk to our friends from NEOM shortly, as the first of the sessions that we're discussing this week. I've just seen that Ibrahim from NEOM has joined us, so we'll come to you in a moment. Before we do, though, I want to bring Ross in, one of your colleagues, the amazing and unparalleled Cynthia Makarutse. I have to say that because we've fallen over each other in how many countries over the course of the last year or two?
That would be 3 in the last year.
That would be 3. So yeah, South Africa, Saudi, and now in Dubai. I mean, I know you as the person that organises speakers, makes trains run on time, gets people to stages to speak about the things they need to speak about. At Arab Health, you've got a slightly different role in the respect you're involved in the healthcare, the Future Health Summit at the Museum of the Future on Thursday afternoon. Tell us a bit about that event. So that's a satellite event to Arab Health on Thursday afternoon. What's that, and why should I be excited about it?
Right. Thanks for that amazing introduction, Steve. Yes, so the Future Health Summit is a satellite event running alongside Arab Health on the last day, which is Thursday the 1st. And it's basically our only high-level networking and strategic event where we will highlight a singular mega trend in the industry, and then we invite a few world experts to give our guests insights into why they should pay attention to that trend and why it matters for business in healthcare. So particularly this year, which is the 3rd year that we'll be running the Future Health Summit, hopefully as successfully as before. This year, we're focusing on reverse aging and longevity, which is a really big topic at the moment, but it hasn't quite made its way over to this part of the world. And we are really wanting to be the ones to really introduce it to all the C-suite executives within healthcare in this part of the world, to tell them why it's the next frontier in healthcare and what opportunities are available for investment. And just to show you how serious we are, some of our speakers include the Pure Health CEO, Dr. Shaista Asif, Evolution Foundation CEO, Dr. Mahmood Khan, as well as the VP of Longevity at the Longevity Medicine Society in Germany. So, as I said, it's the high-level event, so it's invite only, and it's really networking and information exchange. And yeah, this is where we get all the big guys to come and talk about what they're doing. So yeah, we're excited to be hosting it again.
Well, I'm really looking forward to attending. I mean, last year it was fantastic. I mean, last year I remember meeting the unparalleled Dr. Daniel Kraft, who gave the most unbelievable presentation. Are you going to be able to talk about this time around?
I think we will. I mean, it's a very different topic. You can you can go all kinds of ways with techie topics, but we're excited to see how people receive this because the research is quite engaging and it's very interesting. So we're keen to see. Yeah.
You say it's invite only. Is there any way that you can apply for tickets? Is there a site or anything you can register if you're interested in trying to get yourself an invite?
Yes, absolutely. So obviously people can go on the Arab Health website, click on conferences, and then Future Health Summit will be listed as one of our event offerings. And there you can register your interest. There is a vetting system, obviously, because we're limited number-wise. So everyone is absolutely free to register their interest, and then they will receive a confirmation email once we are past the vetting and they can attend.
Well, all I can say is I hope I managed to pass the vetting and get in, because it sounds like a fantastic event. Thanks very much for that, Cynthia. As I say, we're whipping through a whole series of interviews this morning. And my next guest, Ibrahim from NEOM. NEOM, as some of you probably know, is the most exciting and largest infrastructure project in the world. Their healthcare strategy has kind of come together over the last year or so. I had the honour of interviewing Dr. Mahmoud Al-Yamani at the Global Health event in Riyadh earlier on this year, so I've had some insight into that. And NEOM are going to be one of the sessions on the Healthcare World stage. As I say, that's on Wednesday the 31st, all day starting at 8 a.m. If anybody who's watching would like to register for a place, places are limited on the Healthcare World stage, but you can go to the Healthcare World website at healthcareworld.com and click on the events tab. And you will see a registration link to register for the Healthcare World stage if you'd like to attend some of our sessions during Arab Health. So, Ibrahim, thanks very much for joining us this morning. Great to see you. I guess the obvious place to start for those who don't know NEOM or aren't aware of it, can you tell us a little bit about what NEOM is and how it works?
Oh, thank you. Thank you so much, Steve. This is a great honor. We are very excited to join. We are very excited to join this panel and to bring NEOM and change the mindset about NEOM as only a construction site into actually a way or a place where longevity and livability is exist. NEOM is a very ambitious project that aim to facilitate an area or provide an area where dreamers can actually achieve what they want in almost all sectors, all sectors and all areas of life. And in particular, with respect to the health and well-being, there is a huge ambitious goal of creating this system that allow people to live healthy and longer. So with the ambitious plan of at least 10 years of added healthy life as a moving target. And we are very excited this year for Arab Health to move from this strategy into how we envision the 3Ps, the proactive, preventative, and hyper-personalized approach to health, and how that connect to actually longevity and the added 10 years of added healthy lifespan.
So from that point of view, we've got a session, I believe you're going to be on panel for it at 10:30 on Wednesday on the Healthcare World stage. What kind of things are you going to be talking about? What kind of things can people expect to learn about NEOM and the opportunities for suppliers and providers to get involved in NEOM at that session?
Yeah, that's a very good question. I think moving from the strategy to actual realization of that strategy on the ground, what we want to address is our approach on the healthcare approach of integrated health and wellness. In that approach, we are highlighting how we will be focusing as a system on the all the determinants of health rather than the healthcare system only. And that's a major differentiation. We are talking about how we are profiling, hyper-personalizing, actual materialization of the data and data elements, and how we're going to bring it all to more precise prediction of need and engagement within with our clients, as we like to call them, keeping them healthy and living longer as much as possible. So that's number one. We also want to highlight and emphasize the opportunity on that journey from the profiling, moving to a personal journey, all the way that in the development of our assets and the wonderful use case of the line, as it is structured by design to enable the livability, walkability, and a lifestyle change to be embraced within the environment. So we can actually, in reality, achieve what we are aiming for with 10 years of added healthy life.
So in terms of the way that healthcare will be delivered at NEOM across the line, across the different elements, how will it work? Is it going to be a single provider system? Or are you looking at bringing in multiple providers to provide healthcare to NEOMites?
That's a wonderful, wonderful question. I think we are bringing, we want to show our ambitious plan and what we put in the ground, and open that for the potential partnership in areas of healthcare provision, as well as in areas of community, lifestyle, behavioral changes, name it. And I like your question for two reasons. Number one, in the traditional healthcare system, we're gonna keep looking at the provision as a major element of or major player, and that's very important. And I wish the healthcare planning and provision division here don't hear me, but I also want to highlight that we also heavily focus on the 80% rest of the determinants of health. We have a wonderful golden opportunity for partnership, collaboration, and research in all these other elements, from the lifestyle, behavioral changes, physical activity, sleep, and genomic, and how we actually link that into actual clinic, connect that with actual clinical practice and healthcare provision. So to your point, we definitely gonna open that as a we're gonna highlight that as a concept. And in terms of healthcare provision, we want to show the roadmap and look at the appetite of the market and what they will be excited to have, and then determine whether it's a single or not.
Because that for me is one of the things that I really love about the interactions I've had with Mahmood, with Hani, with the whole team at NEOM, is how open and excited you are about working with the rest of the world. And that's kind of the point of you being at Arab Health, isn't it? Is to show that you're open for business, that you've got your strategy, and that you're looking for partners, suppliers, people to help you to realize this vision of healthcare at NEOM. Is that kind of what you're looking to achieve from Dubai in a couple of weeks' time?
Absolutely, absolutely, spot on. For this ambitious vision, you cannot deliver it alone, and it will not be not realistic and not wise. What you want a global partnership to achieve this dream. The dream for people who works in the healthcare system, fragmented healthcare system, things working in silos, incentives are not aligned. We want to fix it, and this is the only time that I'm aware of that where you have the opportunity to build all the pieces together, learn from all the lesson learned, and ensure that you have the most efficient model that you can then extrapolate and connect back to the whole world. So it's an opportunity for the world to the world.
It's hilarious. It's brilliant because I mean, we did as I say, I did an interview with Mahmood at the Swedish Embassy in Riyadh during Global Health. He and I sat on a stage together and chatted through some of the elements of the NEOM healthcare strategy. And I came off stage. A very good friend of mine, who shall remain nameless, said to me as I came off stage, "It's science fiction." Because it really does when you look at what you're trying to achieve at NEOM. Never mind across the whole city and the whole concept in healthcare alone. It looks like science fiction. It looks like something incredible. Can you really achieve that kind of level of personalized medicine? That level of sequencing the genome of every citizen, of everybody having their data and determinants of healthcare, mapped and understood. Surely, is that not an ambition too much? Can you really do this?
My response is that did we reach the moon? Did we land on the moon? Yes, we did. And it for us, this is to your point. When we have an ambition, goal, work from a scientific point, and have the motivation and the drive globally to achieve that target, you can achieve it. Yes, indeed, you can achieve it. We achieved so far, and we have, for the first time, enablement from all levels. And I like to highlight what His Royal Highness always says. Let them criticize as much as they want, and we will show them what we deliver on the ground. And I think we are very excited this year to show how we are materializing and moving from a strategy, hypothetical, theoretical discussion into actual reality. And we're going to bring all the partners and global partners into that enjoyable journey.
Ibrahim, thank you so much. I feel inspired just from talking to you. For those who want to find out more about what's going on at NEOM, a couple of opportunities for you. If you're able to get a ticket for our Monday night Healthcare World reception at Arab Health at the Conrad Hotel, where Mahmoud Al-Yamani, the head of healthcare for NEOM, will be delivering the keynote speech. That should be a great evening. And of course, Wednesday morning, 10:30 on the Healthcare World stage. As I said before, go to the Healthcare World website, click on the events tab, and you'll find the registration link for registering to come along to that and all the other sessions that we're talking about this morning. Thanks very much, Ibrahim. So moving on, my next guest, Girish Kumar from Knight Frank. You're going to be talking to us a little bit more about healthcare in Dubai as opposed to NEOM and Saudi, as one of the co-authors of the Dubai Health Authority Investment Guide, which will be launching at Arab Health on the Healthcare World stage at 9 o'clock on the 31st. So, Girish, give us a sneak preview. What's in the DHA Investment Guide for 2024?
Right. Thank you, Steve, for having me. I mean, let me correct you there. It's essentially not a launch. It's more of an update and an upgrade to the Dubai Health Investment Guide, right? Because this is around the fourth or fifth version of the guide, which started back
Funnily enough, I was at the launch event. I think I was. Yeah. I compared the launch event for the very first one, I think back in 2019, was it?
18 or 19, if I'm not wrong. And then there were two other editions that Knight Frank was part of as knowledge partners. And this is essentially the third edition that we are working with. But this one is very different to the previous ones in terms of, although a lot of the content would be similar, but what we are bringing to the table this year is a lot more data on the whole expansion of Dubai, right? Because over the last 3 years, Dubai has seen this massive expansion in terms of developments and to areas which are sitting in the south of Dubai, which probably were unexplored before. So what we are targeting is to show what potential opportunities are there for new entrants into the market. Where should they sort of expand into? And we just don't want to show them data, but we also want to show some success stories. So this version will also have a few success stories of new brands which have entered the market and have been successful.
So, okay, so what are the areas of interest? What are the areas of development that we need to be thinking about in Dubai over the coming year or two?
So, I mean, see, Dubai has been divided into various sectors, right? So in at least the analysis that we've undertaken with DHA, the development is happening towards the south of Dubai. So people who know Dubai, there is the whole stretch which is towards the Expo 2020 site and the New Palm. And there's a whole stretch between these areas which are now being developed. And they're very underserved in terms of healthcare facilities, right? These are outpatient facilities, inpatient facilities. So that's where the sort of demand is heading into. But that aside, Dubai itself has so much demand for specialties. And I'm loving the way this conversation has already gone into longevity and wellness, because that's one of the key areas we are focusing on in this guide as well. You would see a little bit more information on why that is a target segment, because wellness is where Dubai also wants to focus into, although Dubai is already known as a destination for medical tourism. There's a strong focus on wellness tourism, right? I mean, preventative medicine is where the whole world is heading into, and Dubai wants to be forefront in that. And this is something we are highlighting in the guide as well.
Mm-hmm. And how can the guide be used? I mean, if I'm an investor or a healthcare provider, how do I use the guide to give me an idea of what I should be doing to enter the market in the city and in the Emirate?
So the guide gives you a step-by-step understanding of what the demand in Dubai is. And plus, it also gives you an understanding of who the stakeholders are. If when you're entering a market such as Dubai, it gives you a clear structure of the processes for each type of facility and who the stakeholders are there. And it has contact details as well. So it simplifies the process for someone who's coming into Dubai for the first time to set up a facility. And as much as, the way things are streamlined in Dubai, the process is fairly quick, right? So it gives you a complete insight step by step, which are the zones, who are the authorities, where can you have a complete ownership, where do you have mainland facilities. So it's got a complete overview of Dubai's healthcare system. So it just eases out the whole process for a new investor. And other than that, it also gives you insights into some of the opportunities that DHA itself has presented to the private sector, which is the public-private partnership opportunities. It highlights the ones which are already executed, it also gives you an insight into what is upcoming. So if you're in that space, it gives you more details on that as well.
So yes, I mean, from that point of view, I mean, PPPs have been at the heart of Dubai's investment strategy in healthcare for quite some time now. Of course, the cardiology centre, which has been talked about a lot over the last few years, is now coming out of the ground. What's next from a PPP point of view? Are there new projects coming up?
There are new projects, Steve, but I think I'll let the guide reveal that. I would talk too soon right now. But the PPP team is going to be available at the event, and they can definitely give you more insights into what is upcoming. But it's a little bit more towards the life sciences sector, this new offering. That's all I can say at this point. But there'll be more details in the guide.
And will there be any kind of content or any insight into the sort of non-physical needs, the non-infrastructure needs of the system? So things like population health data, digitization of the Dubai health system.
Not really. I mean, this time we're focusing predominantly on the sectors in demand. We're not talking about the non-physical infrastructure and information that is required. It's mostly towards just where the demand is, who the players are, what are the success stories, what can you learn from them? I mean, especially some of the new players who've entered the market, how they've succeeded. And there's a strong focus, again, like I said, on longevity, why you should be investing in the wellness sector and differentiate yourself from what is regularly offered in Dubai.
And in terms of the kind of way that Dubai is going from a healthcare point of view, we've mentioned this already briefly. We're moving more into specialisation, aren't we? We're moving into centres of excellence. That's been a consistent theme of Dubai's strategy over the last few years. From that perspective, are there particularly, you mentioned health and wellness there, but are there specific medical or provision sectors that are a particular focus to DHA in Dubai?
There are, and one key sector that DHA has spoken about is a long-term care segment. Especially providing long-term care within the hospital as well as home care setups. That is one of the key elements. There's a strong focus on mental health. I mean, that's another agenda that DHA wants to sort of focus on, and the private sector should be actively involved. And we've already seen that involvement in the last few years. But that is another segment that we're talking about. And then the last bit is the wellness bit that we're focusing on, where we're talking about one, longevity, but also prevention. I mean, you need to have these preventive medicine practices and how they can be brought into the market and, where they fit into the whole ecosystem.
Mm-hmm. So, I mean, so rumour has it that there will be mental health PPPs in the offering. Is that something you can comment on?
Not at this point, Steve, because this is, again, I mean, as we know, there is a bit of transition happening at the DHA, so that will probably come up at a later stage. At this point, it's not mental health, which is the focus for PPP.
So from that perspective, you mentioned also that the reorganisation and the structural change that's going on within DHA. How does the advent of, what has, I think it's now been rebranded as Health Dubai, started as the Dubai Academic Health Corporation, how does that kind of fit in with the investment structure now that there is a public provider in the Emirate?
I think let me just rephrase that question, Steve. I'm not sure I understand that question very specifically, but how does it affect the whole
so essentially, as I understand it, and correct me if I'm wrong here, but my understanding is that DHA is now split into two elements. Yeah. So you've got DHA as regulator and the Dubai Academic Health Corporation, which is just rebranded.
It's not the Dubai Health. Yeah, it's called Dubai Health, and Dubai Health essentially is the operator for all the government sector facilities. So they only act as operators, and DHA will be purely a regulator now. Mm-hmm. So, I mean, but I think the finer details are still in development. So we'll probably need to wait and watch on how each department acts. But as much as we've been informed, DH is purely the operator, and that's where they're going to stay, and DH is going to be a pure regulator. So it's more of putting in responsibilities for each party and having a clear demarcation between DH as an operator and as a regulator.
Either way, though, I think it's still a very exciting part of the world to get involved in as a healthcare provider or as a supplier. And I guess the key element of the reason why the investment guide exists is to encourage and give people an understanding of what opportunities there are in Dubai. If you had, just to sort of close this segment of our conversation, if you had one piece of advice to give to overseas organisations looking to enter the market in Dubai, what would it be?
Invest in specialized care, invest in the markets which are untouched. There's definitely an opportunity there, but plan your investment. Just don't go and open right next to another hospital just because that works. Just plan it out. Dubai has a lot of opportunity, but you just need to plan it out right.
Grace, thank you so much for your time. Look forward to seeing you for the session on the 31st.
Right. Thank you, Steve.
Moving on then to my next guest. My next guest is the incomparable Egbert Schillings from Vara. He's going to be joining me on the Healthcare World stage at 2:00 on the 31st to talk about, as part of our session on public health. Egbert, tell us a bit about Vara and where that fits into the public health agenda.
Well, thank you, Steve. It's a pleasure to be with you. You and I have been in this sector for a long time. I'm not going to share which decade we're into, but you develop sort of a long-term view of things. And I remember a time when people really weren't aware of public health as a thing that was pursued. It was only, sector insiders who talked about public health. Then came the pandemic, and all of a sudden people realized that's actually a focus of human endeavor is to work on public health issues. And obviously, for us as a company that focuses on a specific NCD, and that is breast cancer, we fall squarely within that remit of public health because, there are three domains to public health. You have promotion, you have protection, and you have prevention, and screening falls into prevention. And I think what was striking is that before the pandemic, we were all focused on NCDs. Everybody recognized this is where the burden of disease comes from and where the majority of the mortality comes from. Now we're sort of emerging out of the shadow of that and are finding, not least in the region, that the old nemesis is still there. 74% of all deaths in the MENA region are accounted for by NCDs, and the only way to really tackle it is through a thoughtful public health approach that has a square focus on prevention, and within breast cancer, that means early detection and screening. And that is a sort of whole of government approach, which we, I think, learned from the ground up as being part of the German National Breast Cancer Screening Program. So I think for us, it is our natural home, and it is where we seek to make our mark beyond where maybe other AI companies would do so.
I think public health is always a really interesting arena. The thing that always worries me about public health is who pays for it. Because at the end of the day, if you look at, Middle Eastern health systems are largely insurance-based. Insurers, by their very nature, tend to be reactive. And yet there is this whole kind of, as you say, focus around actually, if promotion, protection, prevention, if you can get those things right, you reduce your overall cost. How do we get that message through to insurers that they need to invest in public health?
I think it's actually, for me, in the past few months, talking to different stakeholders in the region, in particular in Saudi and elsewhere, I'm struck by something that I think is in our favor as we're trying to move the needle on NCDs, and that is systems thinking. I think there are more people who understand that we have to stop thinking reactively about interventions only that we then reimburse, but that we have to think about the longitudinal business of health, and that there is an economic cost to not taking a systems view. So in talking to governments in the region, I think there is a keen awareness that it's not just a question of what we talked about, mortality, that it's not just a question of, that your chance of dying of an NCD in the MENA region is, 19%, which is much higher than it is in the OECD of 11%, but it is the impact on the human capital and therefore the impact on the economy overall. So what I found in the region is that you have governments who are squarely focused on the fact that, especially say the GCC, is one of the few bright spots in economic activity in the world in the last 12, 24 months. And that the direct and indirect costs of neglecting NCDs, and especially in things that you can truly inflect, as with breast cancer screening, detecting it early treatment and diagnosis, which leads to lower cost and better outcomes, that is a calculus that policymakers have to make sure that they push into their system, that if they are a single payer system, as often is the case, that becomes part of the natural calculus. If they have a private sector, which is of course thriving and expanding with all of the PPP initiatives, then that becomes also a regulator and policy focus area. And we see it partially also the responsibility of technology companies to inform that discussion with data that may currently be missing. And that data means entire screening pathway design. So to go back to your original question about how VARA sees itself in the public health space, we, I think, uniquely among AI companies in this space, we don't look at breast cancer as an intervention, you know, where a radiologist reads a scan and is supported by AI to come up with a better outcome. We actually look at this as an end-to-end pathway for the patient who needs to be navigated. And in our case, it's not even a patient, right? Because it's about screening asymptomatic women at scale. What does that mean? You have to have good awareness and activation, invitation, going to the scan, finding out what the results are, and if the results in the further investigation is needed, that has to be done in a timely fashion. In order to do this for an entire system, you need to have an end-to-end design. So for us, this is not about a scan or applying AI to technology. This is about a systems view and navigating a patient comprehensively. And I think that's a discussion that we're finding is extremely fruitful as policymakers in the region are looking at it and saying, we actually, as a region, have an opportunity to leapfrog Europe and the US in the design of health systems. We have legacy systems that are fragmented, backwards looking, intervention focused, acute focused. In the region, I find people are looking at it, like your earlier speaker from NEOM was indicating, a much more holistic approach. And I think that's where technology comes into play to support that view.
And it is, you're right. I mean, one of the great things about Arab Health, one of the great things about going to work in the Middle East region is the fact that they have huge ambition to try and create better health systems and better ways of delivering healthcare to a population. I think for me, the issue, and I'll come back to this, where public health is concerned, is that question of, you know, where you have either an insurance-led system or a state and insurance blended system, it feels a little bit like sometimes public health becomes a question of government will say it's the insurer's issue, and the insurer will say that it's government's issue. How do you kind of square that circle? Does it not feel sometimes like public health is the poor relation of acute provision?
It's the poor relation of acute provision because acute provision is full of drama, excitement, and is short-term focused and has lots of data behind it. Of course, people are going to look at something like the pandemic, which sucked the oxygen out of everything else, or other illnesses that are very immediate. And you're absolutely right. When you're looking at issues like cancer prevention and early detection, you need to take this long-term view. Why do we lose out? Because we cannot supplement our case with the right data to make it dramatic. And I think once you shift that around and you say, look, in countries that have been good at creating well-designed screening programs, you have seen a 90% drop in mortality. You can see that more than 90% of, for instance, breast cancers in, say, Denmark are detected in early stage. Well, if you're in early stage, you have a better than 97% chance of 5-year survival. If it's stage 4, which is still too common in the region, it drops to 25%. We need to make sure that we look at these numbers and say there is a human toll. And the economic toll is enormous. In Saudi Arabia, for instance, there is still too many cancers, especially breast cancer, discovered at stage 3 and 4. And the cost of treatment is even higher than it is in the United States. Now, the argument we're making is you can switch that around without actually having to invest so deeply into infrastructure. The big point we need to make is, especially in the region, it's not a lack of scanners. I would even argue it's not just that there are too few screening radiologists. With what we have designed, you could probably take care of the entire population, have a high screening uptake like a Denmark with the existing number of scanners and the existing number of radiologists. The trick is to supplement that case with the right data to show it's in your hands. Let's design it. Let's organize it together.
Because at the end of the day, as you said at the top of the conversation, what you provide. So, you know, VARA providing, you know, AI-based understanding of what's on the scan and what the issues are and what needs to be done. That's part of the problem. If you don't have the promotion element, if you don't have women understanding the need for screening, turning up for screening, you know, if you don't have that kind of public health PR and marketing element to go alongside the technology and the scanners and the individuals, then it's not going to work, is it? You're just part of this problem.
Completely agree. It is about streamlining the patient journey from awareness, as you said, and there's a lot of awareness work still to be done. But even though, when you look at some of the studies, you can see that women know that once they are in a risk group, which is usually just determined by age, that they ought to be going to this. But then what happens? The journey is not a smooth one, right? So what we're arguing is you need to streamline that from awareness, people understand, to the invitation, now I have the opportunity to do it, to then the actual scan, then detection, and then refer to early treatment. That's why we look at this not as a purely medical issue. This is a societal issue. And like your previous speakers have identified, that requires a whole of government approach, where between education, the healthcare system, the government and regulators and private payers come together to sing from the same, sheet, to make sure that the patient understands and the people that are eligible for screening understand that once I go on this journey, I will be in a well-organized, streamlined environment that makes doing the right thing for my health easy. Currently, that's not necessarily the case, but there's a lot that can be done in short order. And I look forward to discussing that at Arab Health. There's no better place for it.
And you've got a fantastic panel to discuss it with. We've got public health leaders from Abu Dhabi, public health leaders from Saudi. It should be a really, really good session, Egbert, and I'm looking forward to continuing that conversation. So we move from NCDs, from breast cancer screening, from public health, to mental health. And my next guest is Sean Cross, who is the International Director at South London and Maudsley Hospital. Good morning, Sean. How are things in South London?
Good morning, Steve. Hope you're well. Absolutely freezing in South London this morning, but we're going to get ready for a nice kind of warm conversation.
I was going to say, one of the great things about us Brits travelling out to Dubai for Arab Health in January is the fact that we get to go from freezing temperatures to about 25 degrees, which is never a bad thing. So
wonderful.
Tell us a little bit, first and foremost, about South London and Maudsley. I mean, you guys, you're the oldest mental health hospital in the world, I believe.
Well, pertinent to this conversation, Steve, certainly the oldest in Europe, but we are beaten, and lots of increasing evidence that we're beaten by colleagues in Mesopotamia, with an older mental health institution in Baghdad, certainly dating back to around sort of 700 or so. We date our history back to a very sprightly 1247. With the Bethlehem Hospital in London. And I suppose since then, over the last 800 years, through a whole series of iterations, which included formation of the National Health Service in the UK after World War II, we as a group at the Maudsley and the Bethlehem Hospital are one of the most established mental health providers in the world, and we're very proud of the history that we have in trying to take mental health assessment and treatment to the world, because we're interested both in terms of being a centre of innovation for treatment of core mental health problems, but also being able to understand increasingly in this post-pandemic world, along with many other people, the importance of mental health in healthcare provision generally. And I think it's those two things, really kind of high quality core mental health for all your traditional mental health disorders, schizophrenia, bipolar, OCD, depression, anxiety, as well as understanding that I think mental health has a lot to offer for all the things that you've been talking about with colleagues in the last hour, in terms of how it overlays in an integrated way with treatment of NCDs, long-term conditions, and a whole array of difficulties that every healthcare system globally is grappling with.
And I suppose the key point to make here is that the ancient Mesopotamians won't be at Arab Health, and you guys will. And in fact, you're joining me, I believe, at 3:30 on Wednesday on the Healthcare World stage for a debate and a discussion about mental health in the region. The Arab region, the Middle East region, and Dubai in particular, of course, is not new to South London and Maudsley and to Maudsley Health. Tell us a little bit about what Maudsley are doing already in Dubai.
Yeah, we're very proud of the fact that we are already part of the healthcare delivery infrastructure within UAE. And so South London Maudsley is a rooted organisation within the London NHS system, based here in freezing South London at the moment. But we're also a proud part owner of a joint venture along with our partners Makani in UAE, where we provide a number of outpatient and inpatient services in both Abu Dhabi, Dubai and the Northern Emirates. We've been there for a little over 8 years now, and during that time have grown and hopefully will continue to grow, and trying to bring the best of NHS provision of a kind of core public mental health service, both inpatient and outpatient, to the region, with all the kind of quality assurance and all the history of trying to do this in the best way possible through the learning that we have from being one of the largest research and teaching institutes globally for mental health is really important. And it's been a fantastic journey over the last few years, and we hope it will continue to be a journey of expansion, not just within UAE, but across GCC and wider Middle East region as well, because we are very much open to collaboration and enhancing mental health for all, which is basically the vision that we sit with.
And of course, you sit within the National Health Service, the oldest free at the point of delivery health system in the world. Alongside you and your chief exec, we've got people like Jackie Rock, the chief commercial officer from NHS England, Jed Byrne, the international director from NHS England. We've got some very senior, in fact, I think the medical director of NHS England is also joining us at Arab Health this year. Why do you think the NHS is so interested in working in the Middle East? What is it about that relationship between the Middle East and the UK that makes the NHS such a kind of in-demand partner in the region?
I think the way to answer that question is to recognise that there are sort of multiple levels, and there's a richness to it, and it's in that richness that I think there are so many opportunities. I mean, there are obvious, more recent historical links between the UK and the region across the 20th century, but it's also, as previous colleague Egbert was saying, one of the kind of most dynamic kind of places in the world globally at the moment, and helping to lead the global economy. And so with that comes the ability to basically think a little bit differently, start to make investment decisions, and start to think about how you would like to run a health service for the benefit of your whole population. And I think one of the huge benefits of the British NHS system is that although there's no denying that post-pandemic things are definitely struggling and a little bit of a challenge, but there's something quite intoxicating about that notion of free at the point of demand and trying to ensure that what you do is offer the highest quality healthcare for your entire population. And that is an enormous struggle. It's in some ways it's much easier to be able to say, I want to offer an incredibly sort of high quality service to a small proportion of people who are able to afford the best. And of course, I'm not denying that is something that some countries, some organizations and some individuals want to seek their healthcare through. But if you're a state and if you are a region that is wanting to basically have the best and pursue the best, then it's going to be about recognizing that engagement with things like an equalities agenda, engagement with things like ensuring that population health is at the heart of what you do, then you need to start thinking about your entire population. And this is where I think our work in public mental health, as well as being able to think about mental health in its core and integrated way, has a lot to say, and which is why I'm looking forward enormously to the longer conversation with you and colleagues in a few weeks' time.
I think there's a really interesting point here when you talk about the NHS as well, in the respect that, as I think Jed Burns said this, the International Director at NHS England, that there's a thing here about the fact that we have the oldest free at the point of delivery system in the world. I don't know about the ancient Mesopotamians, maybe they did as well, but there is a thing there about when you've been doing something the way that we've been doing it for such a long time, the ability to actually reach into a new, dynamic, developing health system and see how you would do it if you were setting something up from scratch now and bringing that learning back to the UK. Is it a situation of it's not just about what we can teach, but also what we can learn as the NHS?
Oh, absolutely, 100%. I mean, this is not a new neo-colonial endeavour at all, is it, Steve? This is about bilateral learning, about partnership, and about trying to create better ways of working for all of us. The innovation and dynamism that's in play in UAE certainly has a lot to offer the UK as well, and I hope very much that our continued expansion in GCC will also bring significant benefit to the ways that we operate back in the UK as well. This is definitely a two-way street in terms of business operating, but I think is also, that there's also a huge amount to offer for things like our quality service provision and our research already. For example, to give you one small example, a group of our psychiatric trainees in London, a group of our psychiatric trainees in UAE, having conversations and ongoing pieces of work to ask questions about how do you offer the highest quality mental health care in genuinely multicultural environments. The multiculturalism that exists within UAE, very different to that which exists in London, but the same challenges, the same advantages, and the same points of focus for research are definitely there. This is a two-way street, undoubtedly.
Thanks very much, Sean. Look forward to seeing you on the Healthcare World stage at 3:30 on Wednesday. To remind everybody again, go to healthcareworld.com, click the events tab, and you'll find the registration link there for registering to attend the Healthcare World stage. As well as the Healthcare World stage, we're also going to be running a whole set of sessions on Monday afternoon in the Smart Hospitals Zone at Arab Health. And I'm very pleased to be joined by the stars of one of our very first session at Arab Health this year, Julie Coote from BRG. We're going to be talking about clinical benchmarking. We're going to be talking about quality. What do we mean when we talk about benchmarking? What is benchmarking?
What is clinical benchmarking? So essentially, it's a system by which we measure and compare. I think often people think of benchmarking as looking outside of their own organisation to look for best practice. But actually, what I would advocate is that benchmarking should start at home. You need to understand what's going on within your own organisation to understand how you're performing against your own peers. And that's it in a nutshell, really. I think we can get very, very flash about it and the algorithms and the methodology, but it's understanding how you're performing against peers, whether they be inside the hospital walls or the other side of the world.
So at the end of the day, putting this really, really simply, this is about providing reassurance to the health system, to the government, to the patient, that the healthcare they're receiving is of the quality that they would expect.
And it's all about understanding the processes that are involved within the patient care and measuring the right things. I think organisations and ourselves get very carried away now. We've got access to masses and masses and masses of data about lots of measurements. It's understanding what are the right measurements and how we're comparing. Very often organisations like to compare to the best in the world. I think in some cases what we have to really understand is that the best in the world may be in a very, very different clinical system. So comparing, for example, a mortality rate for a particular pathway may not actually be comparing apples with apples if you're comparing, I don't know, Outer Mongolia with South London, because the system that's provided to those individuals is very, very different. So the figures are going to be different. But yeah, we want to know that we're giving good quality care and ticking the boxes, but we've got to have the right measures in order to do that.
So again, I mean, what you're talking about there is contextual. I mean, what might be good in one part of the world with one set of disease profiles, one set of social determinants, might be completely different in another part of the world. So how do you square that circle? How do you make sure you're comparing apples with apples?
And that's a really good point, and it's a valid point. One of the pieces of work that we're involved in at the moment is really comparing the UAE region outside of that region, because they aspire to be the best performing. But you've got to understand that actually the data that you're reviewing from the baseline could be collected in a very, very different way. The way that the data is viewed, the way the data is utilized, there are different incentives for data collection, which are going to make it then quite difficult or tricky to start to compare directly. And that's where there has to be that understanding of the clinical system. So it's not just about the numbers, it's understanding the systems and the processes and the culture that goes behind that information. I think very often we can get carried away with hundreds and hundreds of KPIs and reds and greens and ambers. But actually, when you dig down under that information, or you start to triangulate the data, it will give you a much clearer picture of what's informing that final outcome. And that's the important point, rather than to get carried away with the numbers on the boards.
So how do you decide what to measure, and how do you find the comparators to measure it against?
So it's really about understanding the processes that the patient pathway involves, and mapping those processes and understanding which part of the journey is really going to have an influence on the final outcome. And I think it's not all about the hospital stay, and as we've heard some of the speakers talk about today, understanding the systems and the clinical system that the patient encounters prior to getting to the ED, for example, is very, very important, and whether there are the preventative measures or the community care involved in that particular system. So understanding the processes and how they compare in other countries is really important to measure those step points. And if they don't occur, then obviously that is going to finally influence the patient's outcome. So it's important when measuring, certainly internationally, that we have a good knowledge of those different international systems and how they're going to influence the final outcome and quality for the patient journey.
And what does this mean ultimately in terms of what the patient experiences? How do you use this kind of quality benchmarking, this kind of data analysis to really move the needle in terms of the quality that the patient ultimately receives at the back end?
So I think essentially we've got to engage the clinicians with this quality benchmarking, and in order to do that, we need to make sure that we've got the data that we can rely on. We look at the numbers, but we colour the numbers with the information that lies behind and the patient journey, so that once we triangulate that data, so for example, just looking at sepsis outcomes is very cold and what singular view. We have to understand that, have we got a problem in ED? That is the flow through ED? Are they too slow? Are they not getting the sepsis care quickly enough, and which is having a final outcome impact? It's all about bringing it all together and not seeing those numbers as separate entities.
So finally, tell us a little bit about you guys, about BRG and the work that you're doing. Because I know you're already working in the region, you're doing some of this on the ground already. Tell us a little bit about that.
Yeah, so I mean, any quality performance improvement work is going to rely on benchmarking, whether that be internal or external. But as you say, we're working on quite an exciting project, and we have been for a number of years now in Abu Dhabi. Because the region aspires to be the best at what it delivers in healthcare, and are looking to compare outside of the country, and are looking now further to access where there is the best performance, and looking at how they can innovate to achieve that best performance. And again, going back to mental health and community services, it's all about understanding which part of that patient journey is going to influence the final outcome. But the exciting part of this particular project is that actually we've managed to engage the clinicians directly with the data. So we add the additional insight. So it's not just numbers. We bring the colour to the patient journey and feed back to them directly on a quarterly basis about, this is what's happening in your organisation, this is what happens elsewhere. Let's understand which part of it we can improve or change to give you those better outcomes. And across all of that organisation, we've had great engagement to really understand what those numbers are showing with additional colour. And it is really quite exciting, because we've seen some massive changes.
And I think we've got on your panel, we've got some of the clients that you've been working with, haven't we? So we'll be able to see some examples directly from the clients themselves of how this stuff is working. So really looking forward to that. Your session noon on the first day of Arab Health on the 29th of January. That's going to be on the Smart Hospital stage in the Smart Hospital zone. To those watching, you don't have to register to come and join us in the Smart Hospital Zone. Just come and seek us out. Plenty of seating, plenty of opportunity. And you see Julie and colleagues at noon on the first day of Arab Health. So, Julie, thanks very much. Look forward to seeing you in Dubai.
See you then.
This is great. I'm really enjoying this because it's a whistle-stop tour of all the things that we're doing and all the content that we're going to get involved in over the course of Arab Health, and really kind of going from one really interesting area to another. So we go straight from clinical benchmarking to environmental sustainability. And my next guest is Richard Cantley, Head of Healthcare for Mott MacDonald. Good morning, Richard. Where in the world are you today?
Good morning, Steve. I'm just in our London office at the moment.
So you, like Sean, you're freezing then, are you?
Very cold, yeah.
So Richard, we're going to be talking sustainability. We're going to be talking net zero on the Smart Hospital stage on Monday. You and I have talked about this a couple of times, and I think that the piece of insight that really fascinates me that I'd like you to explain to our viewers, the kind of vicious circle of healthcare as an incredibly polluting industry, and the need to kind of clean it up, because essentially it becomes a self-perpetuating problem. Talk us through that.
So, yeah, so in terms of the vicious circle, as I've explained it to you, I think it's well understood that climate emergency is also a health emergency. And as has been quoted by the WHO, climate change is the single biggest health threat facing us. So the impact of climate change has got a direct impact on health, whether it's through extreme weather events, heat stress, implications on air quality, water quality, food security, vector distribution, etc. All of those impacts of climate change directly, affect our health. And that then leads to, all sorts of health implications, whether it's, injury, mortality from extreme weather events, heat-related illness, waterborne diseases, etc. All of that is, having an impact on people's health, and therefore that then puts pressure on the healthcare, and the demand for healthcare increases. So that's one side of the coin. If you then look at the carbon footprint of health systems, so typically they account for about 5% of all global emissions, and in some countries that goes up to about 10%. So if healthcare was a country, it would be the fifth largest emitter of greenhouse gases on the planet. So what we've therefore got is, climate change impacting health. The healthcare systems are there to make people better, but by having, contributing to climate change, they're in effect increasing the demand for healthcare. And so it goes on, as there's more demand for healthcare, then the carbon footprint increases. So you end up in this ever increasing circle. So, I think if any industry or sector needs to really address carbon head on, healthcare must be one of those, given its the direct impact of climate change on health.
So what is it about healthcare that makes it so polluting? Why is healthcare such a bad actor in that regard?
I mean, I think there's probably a number of different reasons. So first of all, healthcare is a massive part of our economy, and it's a massive industry in itself. So, naturally, just proportionately, it's going to have a large carbon footprint. And as I've just explained, that's ever increasing as demand for healthcare increases. But healthcare as a system, it's also it's got energy intensive processes, it's got energy intensive buildings, it uses a large amount of consumables, it's got a large supply chain, a lot of transportation needs. So all of those things do make it more carbon intensive than many of its peers, so to speak. And if you then, that's thinking about the healthcare system as a whole. If you then start to think about, hospitals. So hospitals are, carbon heavy, energy intensive buildings. They operate 24/7. They house a lot of equipment. They have very strict environmental requirements around about temperature and ventilation. And all of that, quite rightly, is driven by patient safety. But that all leads to, large hospitals being pretty carbon heavy. And a lot of hospitals also, particularly if you look at the UK, there's, a lot of old retained estate. And a lot of those buildings have been designed, before environmental sustainability was really properly understood. And, so all of these things just contribute to it. I guess the final point is that the nature of healthcare, traditionally, the two key considerations when there's healthcare system planning or transformation going on, the two priority drivers have typically been patient outcomes and health outcomes and cost efficiencies. So you can't argue with that. Those are absolutely fundamental. But because of that, probably sustainability has taken a back seat. And I think there's an opportunity now for, sustainability to be considered alongside those other two and other parameters.
Is it a question of that, when we've looked at carbon neutrality, when we've looked at reduction of pollution, that healthcare has almost sat there and said, well, we're healthcare. We're too important. We don't need to, we need to worry about making people better. We don't need to worry about our own carbon footprint. That we've kind of pushed sustainability in healthcare to the back of the queue.
Yeah, I guess I can't really talk on behalf of health systems, but yeah, I mean, saving lives is absolutely, the key role of healthcare systems. So, you prioritize on what is the most critical thing to you. And I think now the opportunity is to start thinking about sustainability, in a different way, and recognize that it also is an important consideration that needs to be taken into account and planned around.
So how? That's the key question. I guess that's what we're going to be considering in a lot more detail when we're on the panel together in Dubai. But what are the most obvious wins in terms of decarbonisation of healthcare?
I mean, so the panel, Arab Health, is going to, the NHS are going to be on the panel. So they are, the first healthcare service in the world to commit to becoming net zero by 2045. And in 2022, they've written net zero into legislation. So, they are doing some amazing things, and that's really heavily endorsed by WHO, who's pointing to healthcare systems around the world to follow. So we will hear from the NHS on the panel about what they're doing, but in effect, you know, the sort of things is everything from, you know, adopting a very systematic approach with a clear baseline, setting ambitions, targets, and detailed plans, recognizing that those plans, you know, it's hundreds of projects that are interrelated, are needed, some of them relating to buildings, some of them relating to food supply and supply chain. You know, so it's thinking about all the contributions different parts of the system can make. It's about system reconfiguration. It's about trying to build less, you know, as we move care out of hospitals, closer to home, communities, you know, moving more services out of carbon-hungry buildings. And then things like, you know, how you actually, when you do need to design a building, how you do that on the basis of a low carbon and net zero technology. So, you know, I think we're going to hear and debate at the panel a whole range of different approaches, from corporate level strategies down to project specific interventions.
I think we're at 1:30 on Monday on the Smart Hospital stage. Again, you don't have to register, just come along and join the audience for what should be a really exciting and really interesting debate. Thanks very much, Richard. Look forward to seeing you in Dubai. So last but not least, I've got a two-hander for my final interview of today's session. Welcome to Simon Swift, who is my colleague at Healthcare World and our data correspondent, and Waleed Katan from Be Healthy. And you guys are going to be together on probably my favourite title of the week on the Smart Hospital stage at 3 p.m. on Monday. We're discussing the data continuum in healthcare, a title that, Simon, you came up with. What is the data continuum in healthcare, and what do you mean when you're talking about it?
Hi, Steve. So this is the way I think about the range of uses of data across the continuum of healthcare. We've heard various people over the last hour talk about personalization. We've heard them talk about public health. We've heard them talk about systems. And there's an underlying continuum of data across all of this. There's a lot of talk about population health management at the moment. And if you think about a left to right line, at one end, we have countries, systems, populations, large numbers of people, of organizations, large amounts of money, aggregations. And we use data at that level to understand system level requirements, population level requirements, service requirements, and we can design using data at that very high aggregated level. You then move along that continuum and you get to small cohorts, a town, a city, if you're thinking geographically, or a specialty, a service, a condition, if you're thinking about healthcare verticals. And again, you use the same data, but at a more granular level to design the scale or shape of a service for a population, or the workforce for a specialty, or whatever the requirement might be. You then move along the continuum to the next step, and you get to, people use the words interchangeably. I tend to use them slightly separately, but we've got personalized medicine. So again, it's the same data and the same maths, so segmentation, stratification, impactability modeling, to understand what does this individual need and how are we best placed to help them? What is the right intervention for this individual, driven off their personal data and research and evidence of what works for who. And then you move all the way to the end of the data, precision medicine. Again, this is the way I think about it. Other people might use those words differently. And this is where we get into the really granular details. So we get into genomics and proteomics and, okay, this person has this disease and this genetic profile. This medicine will work for them better than this medicine. But it's all across that whole expanse. It's one type of approach, one type of thinking, which is about using data to inform decisions.
Now I understand. Thanks very much for that. That's really helpful. Well, Lee, coming to you, I mean, Simon's talking about lots and lots of clever things about how we can use data. But the first thing, of course, we need to do is get hold of that data and get hold of the quality and volume of data that we need in order to use it to make these kind of clever decisions and clever prognosis. I guess from your point of view, Be Healthy, you've got a digital application which is used, I think if I remember right, it was originated in Finland, it was used by the largest provider in Finland, so been battle tested there, been battle tested elsewhere around the world. How does something like your solution help to capture the kind of data that Simon needs to do with clever things?
Yeah, thank you, Steve. I mean, fundamentally, our platform is, the ability to engage with patients. So everything I think most of the speakers spoke about today is so critical and involves the patients themselves and communities themselves taking action and participating in their health journey. And really where Be Healthy's patient engagement platform comes from is bringing that holistic solution for the healthcare providers, but also for the patients. We know there are many solutions out there that exist for, viewing your health data, doing online booking, having remote conversations, even building out care plans. But with Be Healthy, we provide all of that in an integrated offering. So all these services function better together. And it provides a much easier experience for the patients, for the professionals. And you did mention, we have started off in Finland in a 100-year-old healthcare provider business. And, we are one of the longest running solutions. And that really provides a lot of the intelligence and learning that's been built into the technology and the platform itself. And that's really what we can bring, unforeseeable or unforeseen efficiencies in how you perform these remote consultations and in how you engage with your patients. And obviously, our end users love using these services. And it helps the providers get access and get the data they need, and also be able to engage with those insights and findings that they've captured.
One of the things I love about what you guys do is the fact that you're not talking about a venture capitalist or a clinician coming up with a piece of technology and then trying to sell it. This came about because a healthcare provider went, I need a thing to do a job, and developed a tool for themselves, which you now sell elsewhere. So coming back to where Simon's coming from with the kind of clever use of data stuff, is that something that has been built into this system? Is it something that, in the Finnish example, have they taken data from the Be Healthy platform and then used it in the kind of ways that Simon's talking about?
Absolutely. And really, like you said, these tools were built out of a need that the healthcare provider had where tools never existed. So they began tinkering and building these specific technologies to gather the right data and insight that they needed. We work on examples right now in Finland, actually one of the most innovative public healthcare regions, in their population management program. So citizens that can opt into the program are monitored based on their key health indicators. And those that are identified to have any high risk groups for chronic diseases are taken into a preventative program. So it's been really inspiring just to work on such a project that really brings huge benefits to the citizens in that region, but also cost savings for the region by ensuring healthier populations.
So how's that going to translate into the Middle East then? What's your ambition in terms of taking Be Healthy into the Middle East region?
So really, we're obviously we're now based here, myself, and we work with clients in the region. But we have seen, and everyone we speak to, either insurance or healthcare provider side, really a real hunger for taking advantage of, let's say that energy, the vision of the entire region to deliver these exceptional experiences. And a lot of these exceptional experiences are based off of data and really understand what you're doing, what you can do better, and being able to deliver those better experiences. So our platform really helps to bring all of that together, allows people providers to take advantage of, again, that expertise we've built, being in their shoes as a 100-year-old healthcare provider, but really take advantage of the usability of the software, and deliver that really to their patients and to the population.
There is, isn't there, I think, a real ambition and a real desire on the part of Middle Eastern healthcare systems, providers, governments across the region to try and do digital health properly. We talked when we were talking to Sean about the fact that we're talking about dynamic health systems that want to do it right, that want to do it different, that want to do it better. Huge ambition in Saudi, in the UAE, across the region to develop population health solutions. But how do you actually match that ambition to action? Because it's all very well talking about it, but Simon, how are they going to do it?
They're doing it very aggressively, as in making it happen. I'm not completely into the weeds of this, but I know CNHI, the national actor, has specified that the regions and clusters must develop a population health management approach across Saudi Arabia. They've been very clear on what they require, very long list of deliverables and stage gates. I'm currently part of a conversation with a cluster as how they are going to implement it, how they are going to evidence that they have done this. And it's a very comprehensive population health management solution that is being specified and rolled out. And the timelines are aggressive. The cluster I'm talking to at the moment, they are expecting to have this rolled out and operational this year. So there is very strong drive from the centre to make this happen, and the clusters are responding. I've seen a lot of activity in the market, a lot of conversations, some of which I'm part of, and it is being done at speed.
At CNHI, that's the Centre for National Health Insurance in Saudi, whose chief exec I was lucky enough to chair on a panel at Global Health. So I know that the Saudi ambition around population health is huge. That, of course, is driven at a government level in a public health system through the clusters and the CNHI. Waleed, you're sitting there in Dubai, which is more of a private-led system, more of an insurance-led system. How does their approach to data and their approach to population health differ in that private insurance-led system as opposed to the bigger public system in Saudi?
I think, exactly like you've mentioned, I think all organizations here have a really ambitious vision. And we're actually seeing that it's very common to fall into a trap of trying to do too much all at the same time. So when you don't have, such a prestigious national mandate and push, these organizations are just getting caught in trying to build something that's perfect. They're spending a lot of time in the planning and designing phase. And we've really seen that it's critical for them to really get the courage and just start. You need to pilot with something, potentially smaller than the full vision, and take those learnings and then go bigger. Take the step by step and continuously improve on those initiatives.
Because the issue with a private insured system, Simon, is the fact that you've got a disparate number of actors. So you've got a number of organisations that hold data, which they will quite naturally, as private entities, think of as customer data and not necessarily want to share with each other. So from that point of view, how are you able, or indeed are you able, to bring together the sizes of data set that you need in order to be able to make the system make the kind of analytic decisions you need to?
So this comes back to something Egbert was talking about earlier, which is the relationships at an organisation and population level between health and economics. It is generally considered a truism that high quality care, and if I sort of expand that to good health, is cheaper than bad health, and cheaper both from a healthcare perspective, but more valuable from an economic sort of, UAE PLC point of view. A healthy population is a more productive population. So at the very highest level, the concepts work. It's then about making the case to the person who holds the budget. So this is about doing the thinking and the maths to demonstrate bluntly the return on investment for making these decisions, investing in these services and systems at a population level. And every time I've been involved in that, the maths does add up. There is one small wrinkle in this, particularly with a disparate system with payer provider splits, in that it is common that the effort to deliver the value and the value that is realized are potentially in separate organizations. So, and it's a classic problem in the NHS is a hospital has to do more work to improve somebody's condition at the point of discharge, which reduces their likelihood of having a problem in the community. Now, the benefit of that is they're less likely to need care in the community, which is not a benefit to the hospital, and they're going to cost less to care for, which is not a benefit to the hospital. So the hospital does the work and the benefit accrues elsewhere. So understanding that at a system level and being able to have a system level conversation about risk and benefit trading is the mature approach that is difficult.
So let me take that a step further and take that example into the Middle East. So this is something that I will not name names. It's a confidential conversation that I had some months ago. The issue that you have from an insurance point of view, which a very good friend of mine, who I say confidentiality will be respected, but a senior director of one of the big insurers in the Middle East, talked to me about the average lifespan of a patient within an insurance provider. So on average, a patient will stay with their insurer for around 2 to 2.5 years. And the actual benefit of sharing data between insurance companies, providing enough of a sized data set in order to make analytical decisions and policy decisions. Essentially, sharing that data over that period of time is not going to benefit you, it's going to benefit your competitor, is the way that it was phrased back to me. I want to throw that one at you, Simon. What's your response to
that? So sharing your data with them is a benefit to them, not you. So sharing their data with you would be a benefit to you. So if you both share data, then 1 + 1 might equal 2.5.
But that also requires you to work very closely with your most direct and immediate enemies.
And I used the word maturity earlier.
Lies, yeah. Well, this is the thing, and I think at the end of the day, that's why in insurance-led systems like Dubai, it's probably going to take kind of federal intervention in order to ensure that the systems share with each other. Waleed, I'll come back to you for the last point and end on hopefully a positive note. The other thing, of course, that we've been discussing with Richard is that this issue of the environmental impact of healthcare. Surely a digital solution such as yours, does it not mean that we need to build less infrastructure and therefore have less pollution? So aren't you good for the environment?
Yeah, I mean, great angle, Steve. I mean, obviously, there are definitely angles on it. I'm not sure we've studied quite the impact of how many patients would drive into, they're obviously their clinics and hospitals. As you can imagine, we're actually empowering the service providers to treat their patients, but we don't eliminate the need of them seeing their doctor in person. I mean, this is, by core, the function of the healthcare provider. Our solution makes it easier and provides them a better experience while still, receiving the care that they need. And you know what? A lot of that still involves the infrastructure. A lot of that still involves visiting a clinic, getting your tests done. And I think when we are talking about the sustainability element, that still has to be addressed, whether you're using digital services or not. But at least we minimize some of the drives where it's not necessary. So definitely,
well, less driving to the clinic because you can see them online. Well, look, that's all we have time for this morning. And I've got to say, I mean, too many panelists, too many interviews to thank everybody individually. You all know who you are. You've all been fantastic. You're all going to be joined by a huge number more insightful and interesting people on the various stages at Arab Health. To remind you to register for the Healthcare World stage on Wednesday, go to healthcareworld.com, click on the events tab, and you will find the link to register for the Healthcare World stage on Wednesday. For Monday, for the Smart Hospital stage, just rock up. We're on stage from 12 o'clock. Should be fantastic. We also have the Healthcare World stand. So please do come and visit us on our stand at Arab Health. And huge number of really exciting things going on through the week, including our reception at the Conrad on Monday night, including some of the work that we're doing with NEOM, including some of the dinners and networking events that we're doing with our partners. If anybody out there is interested in joining us at any of those events, please just reach out to me on LinkedIn or on email. I'd be delighted to have a chat about involving you in our events. But look, all I can say is that at the end of this session today, I'm really excited about getting to Dubai in the next couple of weeks. Really excited about some of the conversations we've had here and extending those in person and seeing everybody in person out there in the Middle East. So thank you very much, guys. Keep an eye on LinkedIn as well. We've got updates going out regularly with our speakers, our panels, and that registration information you need. So please keep an eye out there as well. Hopefully I will see as many of you in Dubai as I can, and I look forward to it. Thank you very much for joining us, and we'll see you again soon. Goodbye.